Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
A mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Stephanie Whitaker, and she's the Chief Nursing Officer at Mercy Hospital Fort Smith Communities. Stephanie, thanks for being here.
Thank you, Robin. I appreciate you having me on.
So we're talking about nursing today in the workforce. Can you describe the current state of nursing at Mercy Hospital Fort Smith? And you're doing some really innovative things.
Well, thank you. We are exciting. Nursing is building a future here in the River Valley, and it's a complex and challenging process with the nursing shortage across the nation. But we're navigating this with forward thinking, innovation, and really engagement with our nursing community and with our students, starting even at the eighth grade level to get them engaged in healthcare.
So what do you believe are the primary factors contributing to the nursing shortage? It's not just local, right?
No, it's not. We're still coming out of the pandemic from the COVID pandemic, and there's still some challenges related to that. We saw a lot of healthcare professionals that retired during that season, and when we were already in a shortage and then have early retirements, or people make complete career changes based on the pandemic and the effects that it had on their well-being, mental health, and their financial situations, they left healthcare. So we're still moving forward out of that. We also have challenges with nursing schools having enough trained faculty to add students to their programs, which then in turn delays getting us new nurses at the hospital or clinics anywhere across the nation. So really academic faculty and just really building that pipeline is what we need. There's the challenges of the shortages.
And how has the shortage affected patient care and nurse workloads at your facilities?
Coming straight out of the pandemic, the nurse workload, I would say, was much higher because of the challenge of that gap. And we had a lot of agency or contract labor. And those team members were traveling all across the country to help support patient care. So at that time, there were a lot of stretched ratios, meaning that nurses were taking care of more patients than what they typically cared for, just to meet the needs of the patients in our community. Those have come back down. We've been very successful in bringing those back down to normalizing ratios that are standards across the industry. But the acuity of the patient is still very high because there are a lot of side effects from those who receive COVID and ongoing chronic illnesses and challenges. Our patients across the country just continue to get sicker when they're in the hospital and have more challenges. So we're here to meet those needs, and that does bear a burden on the healthcare workers, especially the nurses who are with the patients 24/7.
And you touched on this a little bit, but what are strategies that Mercy Hospitals implemented to attract new nursing talent?
We have several strategies. So we start very early in elementary and middle school, talking with students about healthcare, going to career fairs, trying to get them engaged in what an amazing profession healthcare is, specifically nursing. It's certainly a passion of mine. And then we have a middle school program, a health science middle school program with Darby middle school, that is here on campus. So they actually are immersed on the campus and do their education here when they're in 8th grade. So we have that. So we're able to engage them and have them experience healthcare from a different lens while they're in school. And then we partner with many academic programs, whether it's our high school program, Peak, where they train LPNs and CNAs. That is a high school program that we engage. So when they graduate from high school, they can actually have a licensed practical nurse degree. They can also have a certified nurse degree or an EMT degree. So those are some ways that Mercy partners with our Fort Smith public schools. Then we move to the academic level. And so we have multiple academic partners, whether it's the University of Arkansas Fort Smith, Arkansas Tech, Carl Albert in Oklahoma, and many other partners that we allow and invite, really, not just allow, but we really welcome them to come to our facility and do their clinical rotations here. That gives us an opportunity to engage, train those nursing students, and really invest in them. One specific program we have to address these needs is we have a dedicated education unit, and that's for nursing students to work on a unit side by side with a Mercy nurse The two of the student and the Mercy nurse take care of 4 patients together. 2 students, 1 Mercy nurse, 4 patients. So each nursing student really has 2 patients that they can really focus on and learn all of their skills and assessments at the elbow with that Mercy nurse leading them. And it's been very successful in helping them become more practice ready.
Yeah. What incredible experience. And starting at such a young age.
Yeah.
So, how are you working to retain experienced nurses and reduce turnover? Is that something that you're seeing?
Absolutely. It's something we're very focused on because we have to retain our top talent. Our caregivers are essential and they're with the patient 24/7. So we want to make sure that we give them all the resources they need to do their job as easily and efficiently as possible. We also work on focus groups to find out what their needs are and what changes. Each generation has some different needs and different focus. And so we have to adapt at Mercy to try to meet those needs. So we have some flexible scheduling, different workforce layers, and we also try to give creative ways, like on our dedicated education unit, that experienced nurse is training new nurses so they have a lower workload, less patients. So it gives them some fulfillment to give back and train nurses. And that's helping with some of that resiliency and reduce burnout because they can pay it forward and invest in these students and get some joy back in why they went into nursing. Those are just a few of the strategies we're using.
And it sounds like mentorship, support programs play a vital role in that.
Absolutely. That's essential. And so we have a mentorship program, which is a part of our residency program that as you start, when you onboard as a Mercy nurse, you're placed into a nurse residency program that is 12 months. And so you are with a cohort, a group of nurses like you, maybe not in the same department, but experiencing the same things. And then you have touch points all throughout that year with multiple different nurse leaders and support. You have a preceptor program. You have a charge nurse, a supervisor, a manager, a director, and even myself that engage with you throughout your journey becoming a new nurse. So those mentorships don't start there. We connect you and move you forward with that growth and opportunities.
Have you adopted any technological solutions like is virtual nursing, telehealth, all of those things to alleviate staffing challenges too?
Absolutely. So Mercy has a virtual care center in St. Louis that there are nurses there that help support us actually here in Fort Smith with things like sepsis alerts and critical care monitoring, things like that help us. We also have a partnership with Epic and Microsoft to bring ambient technology to the bedside, to the frontline caregiver, where the nurse can really focus in on that patient care. They have a device that actually helps hear the conversation between the nurse and the patient. Of course, it's pre-approved with the patient's permission, but it's hearing the conversation. So you and I can have a conversation about your assessment. And in the background, this AI technology with Microsoft and Epic is pulling those key information in, pulling it into your chart. We can talk about our favorite football team or basketball team. It will not pull that information in the chart. So we can have a conversation that's very meaningful while also getting the very detailed clinical information that we need to be successful in your care and in care planning. Pulls that information in, and then the nurse goes back and validates that information is correct, which is amazing. It shaves off about 2 hours of that nurse's time of their 12-hour shift. So it's taking that cognitive burden off the nurse so they can really provide that compassionate care and exceptional service while at the same time having a better quality documentation for our other caregivers, our physicians, our case managers, our physical therapists, our respiratory therapists. They can immediately see the documentation. They don't have to wait for me to go back to a computer, find a desk, sit down, remember everything we just talked about, or take something from my notes and put in. It automatically goes in. So it also gains efficiency with our other caregivers, not just the bedside nurse.
Wow, that's a game changer in a number of ways. Really incredible.
Yeah, we're piloting it, so we're excited to see. So we'll be starting that. We've started it in St. Louis. We'll be bringing it to Fort Smith in the next few weeks and pilot it on units, and then we hope to have it successfully disseminated through all of our nursing units.
So is Mercy Hospital also exploring flexible scheduling, like part-time opportunities to accommodate diverse workforce needs? Is that something that you see in demand as well?
Absolutely. As we talked about the generations, everyone has different needs and seasons in their life based on what's happening. So we've created multiple workforce layers. One of those is called a gig workforce layer, and it's through Mercy Works on Demand, which is an app that we have. And so if I'm a gig nurse, that means I'm not required to work a specific amount of hours in a week. I can pick up to 30 hours a week, or I can pick up no hours based on what's going on. If I have childcare challenges, or if I have an aging parent that I'm trying to care for, or if I want to go on a vacation and I don't need to pick, I can be a gig nurse, pick up those shifts in the app immediately, and then come to work. And that is for experienced nurses. Our new graduate nurses, we work with you on what the track is and what you need, and kind of work on what are the best needs to meet our patients, and what to get you trained and practice ready to the best of your ability to move from that novice nurse to that expert as quickly as possible.
So many innovative programming, starting from education at really young ages, and even like middle school, junior high, up to now, partnerships with schools, education, and mentoring. So many programs that really sound like they're making a difference within your hospitals, for sure. So, what are you hearing from new nurses about their experience starting their careers at Mercy, and how has that feedback kind of shaped your approach?
Absolutely. So we absolutely survey our nurses, and we have at the elbow conversations of what's working well, what's not working well, how can we better meet your needs. And as we get that feedback, we continually adjust our residency program, our orientation, our preceptor programs, our mentorship. We take that and feedback. Right now, I would say, like I said, we're still coming out of COVID. There's some nurses that during COVID, they didn't get a lot of hands-on with patients because the schools were closed down. And so they were doing a lot of virtual learning. They were doing a lot of sim learning with mannequins. And so we're still partnering with those new nurses to get them more hands-on experience and help build their confidence and skill level to care for those more complex patients. So that's an ongoing approach to those nurses and their needs.
Well, Stephanie, thank you so much for talking about this important work. And I appreciate you being here today and sharing the future of nursing at Mercy Health. Thank you.
Thank you so much. We couldn't do what we have done with these innovative programs without the support of the Arkansas legislation and the Align grant and support that we received. That has been so beneficial in helping us increase our nursing pipeline, and we're very thankful to receive those funds from the state government. Thank you for your time. I appreciate being with you.
Yes, thank you. Thanks so much for being here. And that's it for AFMC TV. Have a great day. Thanks for watching.